Nobody has all the answers. This is about co-creating the solutions and what works now. So when we challenge ourselves to reimagine health and care and other public services, we rely upon early adopters to lead the way, harvest the learning and fail forward to gain essential insights for others to build on. In transforming the systems and the services, we also transform ourselves. As radical leaders and learners, I would invite you to share with each other your experiences of leading and learning in this way.
So my story is I think I just have a kind of gut reaction to why we need to move in this direction. I just know it's right. I don't know why I know it's right, but it's something to do with probably a relationship with a parent of the past. So if you really wanted to psychoanalyze me, I'm sure it stems from that point. And whilst I was leading in a charity in Exeter, I had a very collaborative, open, facilitative style. I then took time out of that and started with a charity last January as their CEO, and I took that style plus a load of really interesting, cool ideas that I thought were really exciting. They didn't, and I left after 5 months. So it was a real hard lesson in how not to pitch up into an organization with these snappy, whizzy ideas, and for it to land incredibly badly and awkwardly at times.
Working frustratingly, supposedly in the middle of health and social care, but actually so far outside the walls it's unbelievable. And yet when everybody understands what we do, they say, well, where have you been for the last X number of years, particularly around hospital discharge and that kind of thing. And so working in a new way was really important for us to be able to establish ourselves as part of the system. But we'd been around for 30 years, and my career is also 30 years old. And having risen to the top of the tree in the hierarchical sense of the word, I realised that there was a much better way to be in an organisation, not to run it, but to be effective in an organisation. And so the most important thing was to learn to let go, which is a really scary place as a chief exec. It's particularly scary for my board because they're going, okay, we trust you, but we're not quite sure how much we trust you, and we're certainly not sure about how we trust everybody else in the organisation. So holding that line, with one foot in both camps, has been really tricky. The other thing that I've personally found is that for the first time in my entire life, I've been described as an early adopter. It's the last thing that I would consider myself to be, but it's quite an exciting place to be. And actually, there isn't a way to do this. You learn as you go, and if there's kind of one thing that I would leave everybody with, is feelings are more important than process.
We had to, when we had to finish at the end of January, which was about managing the closure, but not by choice. We've done loads of work with Andy Brogan and Easier Inc., and we'd also done a values workshop with Jackie, who's here, Jackie Lefebvre. And that values workshop had happened in just before Christmas, end of November. And we had done this extraordinary journey just in one day, and we'd come up with these values. We had purpose and values, and I think it's been mentioned before how important that is for an organisation. And our values were really amazingly well aligned, and all the midwives felt very strongly that we'd captured correctly those values. And it was about confidence and innovation and growth. And but the two that captured for me when we had to end, we had heart, which was about empowering people and being with them, and we had love. And I know love has been mentioned here before today, but love was our value that all these other ones came down into. And that love we described as for being nurturing the women that we were looking after and their families, and also each other. And I had to sit down with all these amazing midwives and everybody in the organisation, there's about 30 of us, and tell them that we had reached the end of the road and that we were going to have to close. And I wasn't sure, they knew that something was obviously amiss because we're very open, but they didn't know exactly what. And so I took a lot of time to try and explain in detail the reasons why, and then stopped and paused, and I asked, obviously, for questions, and everybody was very distressed. And one of the midwives put her hand up to ask the first question, and I was ready for any number of things. And her first question was, "What about the women? What about the women that we're looking after?" And that sort of set the scene for the rest of that discussion. And we closed. We went into insolvency, and the reasons why we're going to plan. We're having something called an after-action review, and I'm a midwife. I don't know all this terminology. I'm learning it, but we're having an after-action review next week, and I'm really keen that it isn't about blame. It is about learning the lessons, because it is all the things we've talked about. It's about commissioning. It's about pilots not being given proper support, and it's nobody's one person's fault. But what we've done, and what the evidence before my eyes has been, is that when you truly work together and you grow a culture, which is difficult at times in the NHS, amongst midwifery, there is a lot of bullying, and we were able to demonstrate that love did win out, and that our culture has been very strong, and that's been the most powerful and actually joyous part of my journey in many ways.
I want to sort of, I'm coming at this from quality. So whilst the self-management is of interest, I think it's about patient quality. It's about providing the best service we can, the safest service, the service that is most tailored to people's needs. And as we heard about the commissioning, it's about relationships and having teams that can deal with variety. People are infinitely complex, and by having that self-managed team, that the team can respond to that complexity. And I think another important point I want to make that really drives me is that I feel that with this work, we're moving from providing services into supporting community. So it is about an assets-based conversation with the patient and with the nursing and care teams. So it's the polar opposite of the sort of time and task way which we've been commissioned for far too long, which we know has actually led to more expense, more cost, and poorer outcomes. It's the polar opposite of that. It's putting the patient at the centre. What assets, what strengths has that patient got? What assets in the friendship group and in the informal networks has that patient got? How can they all be deployed to support better care? And again, with the nurses, I'm really fortunate in my role with the NHS Trust. So it's a traditional organisation, 5,000 members of staff. We have 460 policies. So if you're quick at maths, that's about 11 policies per person. And I'm very, very fortunate that my exec team realise that that's nonsense. We've paid for people to write those policies. We're paying for people to police those policies, to train people to meet those policies. We've got an industry in capturing data and information to track how we're doing. And yet, as an exec team, we're not confident that any of that is improving care. In fact, we think it's actually detrimental to providing good care. So that's what's driving us. How do we provide better care? How do we build community? And it is about, in my view, these very local, hyper-local teams building community that provides care, but also does provide services that fit into people's lives. Very much like the example we had from Gateshead. I've worked in local government in the past, and I think that was an incredible example of bravery, of how we need to change the dynamic. It's not about a public servant doing their job, which the person would be doing who was sending out the court summons or the bailiff. It's about, okay, this has happened. How can we work together in community to solve this issue together?